In this video, we'll talk about which diabetes medications can give you low blood sugar. This is an important topic because low blood sugar can be life-threatening. If you have frequent low blood sugar, then it is important to identify which medication is responsible for that, and then either stop or reduce that medication. Here is a table of the medications that are more likely to give you low blood sugar, or I would call it high-risk medication for low blood sugar. The first column is the risk of low blood sugar. Here, one arrow means there is some risk of causing low blood sugar, and two arrows means there is substantial risk of causing low blood sugar when you take this medication. And the second column are the classes of medications. The third columns are examples of specific medications in each class. I will pause for a few seconds so you can look at this table carefully. Now let's look at medications that are unlikely to cause low blood sugar, or I would call them low-risk medication for low blood sugar. Again, the first column are the classes of medications, and the second column are some specific medications in each class. And I will pause for a few seconds so you can look at them carefully. Then some people might say, what you are saying is not right. I started to take a low-risk medication, but I still get low blood sugar. For example, this gentleman who used to take insulin Lantus 30 units once a day, and then he started to take metformin, and then he started to have low blood sugar in the morning. He did not have any low blood sugar before metformin was started. So here I would like to emphasize that the low-risk medication I'm talking about are unlikely to cause low blood sugar if you just take them by themselves. However, if you add them on top of another medication, yes, of course, they can cause low blood sugar. In this example, metformin is a low-risk medication, so it is very unlikely to cause low blood sugar if you take it by itself. However, if you add it on top of another medication for diabetes, then yes, you can have low blood sugar. Then what's the solution here? Should we reduce metformin, stop metformin, or reduce insulin Lantus? My recommendation would be to reduce insulin Lantus. And the reason for that is because the high-risk medication works by giving you a constant stream of insulin, regardless of your blood sugar level. Even if your blood sugar is low, the high-risk medications like insulin continue to give you insulin, and that can be dangerous. However, for the low-risk medications, they do not give you a constant stream of insulin. Instead, they give you more insulin when your blood sugar is high, and they give you less insulin when your blood sugar is low. So if your blood sugar is already low, metformin, a low-risk medication, will give you less insulin, so your blood sugar does not crash. Or we can compare the low-risk medication and high-risk medications to different types of air conditioner. High-risk medications are those very powerful air conditioner, but they come without a thermostat. So they keep on blowing out a large amount of cold air, even if the room is already freezing. While the low-risk medications comes with a thermostat. If the room is already cold, it will just blow out less cold air or even shut down. So you can say the low-risk medications are the smarter one. And when you are taking two types of medication, you're taking both the low-risk and high-risk medications, and you have low blood sugar, then I would suggest you stop or reduce the high-risk medications first, Or in other words, you want to keep the smarter medications and reduce or stop the less smart ones. In this video, we talk about that insulin can give you low blood sugar. Both the long-acting and short-acting insulin can give you low blood sugar. Then in what kind of situation should I take insulin? Because it is really not such a smart medication. So if you want to find more information, you can go to hmf-diabetes.com and search when should I take insulin or should I take insulin to get more information.